Okay, welcome to another Zoom call. We have a few questions that got sent in. Let's jump right into those. First, some announcements. Please make sure you're checking the members' home page for any announcements. Two big announcements that we've been talking about for a while, and one is that starting January 1st, we're going to drop back to just one Zoom call a week. Remember, for those of you who have been with us, we've only had one Zoom call a week, Wednesdays at 4 o'clock. We added the Monday one just a few months ago for several reasons that now we're just dropping that back. So we won't have Monday's Zoom call any longer starting January 1st. So we'll be back to just one Zoom call a week on Wednesday evenings. And then we've talked about this multiple times. New state laws have come out since the whole COVID thing. COVID allowed us to do a lot of one-on-one calls with members' questions because the state boards basically dropped any mandates about having to be licensed in a particular state in order to do one-on-one calls. Well, that has gone away now. So we're back to making sure all our questions are only on members, the Zoom calls. Legally, we can continue to do Zoom calls and it falls under the educational perspective as far as what we're doing with our members. It doesn't fall on a doctor-patient relationship, which would constitute a telemedicine. So legally, we can't do quote unquote telemedicine. So that was dropped during COVID. So we had 3 nice years of being able to do one-on-one calls. I don't even think anybody on this Zoom call has done one-on-one calls. Maybe once or twice, but we can't do that anymore. So your questions just have to come through Zoom call, which you're really doing that anyhow. We've talked about this. Remember to ask your questions on the site. And instead of emailing those questions in so they don't get lost. And remember that you have free access to all the courses. So take advantage of that. And here's the list of the courses. You can see that on our website. Okay, first question. I have breast cancer that has metastasized to the bone. Just found out a couple of weeks ago. So we are starting nutrition to help with that. But the last couple of days, I've had a lot of tingling in my spine. Do you know what that could be? So tingling in your spine, could that be, the question really probably is could that be the cancer causing the tingling in the spine? Well, it's possible. But more likely, there's probably other possible reasons too. I know when you have cancer, I fall into the same boat. Whenever I get symptoms, the first thing you think of is the cancer. Is it getting worse? Is it coming back? Is it, that crosses my mind, almost every day. And I know it does for you guys too. So, but what I have to keep reminding myself is that not all, as we get older, you just have some symptoms. Sometimes it doesn't always mean that it's from the cancer, but it's not bad to ask that question. You should kind of suspect like, oh, am I doing something that could be aggravating my spine? If I have metastasis to the spine, you do have to be more careful. So you shouldn't be doing, pounding exercises. You shouldn't be. There's certain things that you have to be more careful when you got metastasis in the bone because you don't want a pathological fracture. So when you have metastasis to the bone, typically it's what's called lytic metastasis. So lytic metastasis is where the bone is being eroded or broken down or eaten away. From a radiology standpoint, it's often referred to as moth-eaten, meaning it looks like a moth has been chewing on your bone. It's been referred to as rat bite lesions. So think of radiologists back in the day. That's the kind of thing that they saw in life, right? So it looks like something's been nibbling on your bone. Well, that can weaken the bone. So You don't want to be putting extra force into the spine or the pelvis or the femoral head or something like that, where you could have it with because of the weaker bone having a fracture. So it doesn't mean that every symptom you have is coming from your cancer. So you kind of have to weigh that out and balance that out. Also, I started using DMSO on Saturday when I received it over the liquid. So she's putting this over liquid iodine. So she's putting liquid iodine on her breast and then putting DMSO over that to help drive the iodine into the area. Remember, I said a person can use DMSO to drive something into your body because DMSO is so readily absorbed that it can bring with it other things. You said I would taste garlic in my mouth with the DMSO. My skin is tingling, which it should because it's anti-inflammatory and it dries really fast. So you do get a tingliness of your skin. My skin is tingling, but not getting that taste. Am I using enough? Yes, you will. That you do. Some people are more sensitive to it and get that garlic taste because it's the sulfur and the dimethyl sulfoxide that you get that garlic sulfur taste. And it certainly is dose dependent. So when people used to use it for like knee pain, they would really gob it on all over their knee and you're going to get a strong garlic taste in your mouth. But you're dabbing it on with a cotton ball, not quite so much. Plus it depends on how sensitive you are too. So no, I don't think you should use more if you're not getting that taste. You certainly don't need to have that taste to know that it's working. Okay, I will try to make this story short, see what your thoughts are. After I had COVID, I had a chiropractic adjustment. The next day, I talked to my chiropractor because I could hardly get out of bed. She said that I wasn't out of place that bad, that I should be sore after the adjustment. I thought it was probably from the COVID and achy body. But after my bone scan and all the new lesions, the fracture on my hip, I am thinking that this happened when she was using the activator to adjust. My back is feeling much better now, and I know I still have it in my bone from the blood work, but you tell me that these spots heal up a bit or are just going to be weak. I hope this makes sense. So first of all, if you have metastasis to the bone, again, you're going to have lytic lesions, these erosions in the bony structure, which can weaken the bone. And I highly recommend that you, if you're going to a chiropractor, that you only get adjustments via an activator. So these are low force adjustments. There's other different types of tools that are low force adjustments. Some chiropractors have a technique where they're just use low force pressure. They're not putting heavy pressure on your back, quote unquote, cracking your back. You should, that's just my opinion, but you should not get adjustments that are manual adjustments that cause a gaseous release and that popping noise when you get adjusted that you often get when you get manual adjustments. You shouldn't do that. You should only get activator adjustments. I think that it would almost be impossible for your chiropractor to hurt you with an activator. So even if you have severe metastasis and severe lytic lesions, I still don't think that the chiropractor could hurt you with an activator. So I don't think that if the chiropractor used an activator, if I'm reading this correctly, I don't think your pain is from the adjustment. So I don't think that's it. Now, if you said that your chiropractor adjusted you manually and then you found out you had metastasis, first of all, I don't think it's proper for a chiropractor to be adjusting a person that has cancer with anything but low force adjustment because he or she may not know that you have metastasis. So just like this, you went to the chiropractor not knowing you had metastasis. I think professional conduct from a chiropractor should be, hey, you have a cancer diagnosis. We're only doing low force adjustment with you because I don't know if you have metastasis or not. even if you go, no, I had a PET scan, I don't have metastasis. Certainly, if I was your chiropractor, I'd still be doing only the activator. It's just the right, I just think that's the right thing to do from a professional ethics standpoint. To not hurt the patient, to first do no harm. So if this chiropractor, if I'm reading this right, used the activator, I think they did that correctly, and I would not hesitate to go back to that chiropractor. I don't think that's the issue. Okay, question on the chat. I have been waking up nightly with night sweats. All my clothes and bedding are wet too. Is it good for me to eat a couple of garlic daily? If so, is it better to eat raw or cooked garlic? So night sweats with cancer can be from multiple reasons. You can get night sweats because of how the cancer can affect your hormones. That can cause night sweats. You can get night sweats because of imbalance in your platelets. That can cause night sweats. And there is idiopathic night sweats, meaning that there's not a full known cause of why some cancer patients get night sweats. Some cancer patients don't get night sweats at all. Night sweats tend to be more common in certain types of cancers, blood cancers, but it can be in other cancers as well. So there's hormone causes, there's platelet and white blood cell imbalance causes, and then there's idiopathic causes. Would garlic, eating a couple of garlic, help with that? I don't know. Maybe you read that might help with that. I'm trying to think off the top of my head the physiological benefit of that. Garlic can help with a lot of different things. Garlic can be an antibiotic to your body, can kill pathogens. Garlic can help reduce blood pressure and can help clean the blood. Garlic can be an antibiotic in the blood, can help clear up infections on valves and things like that. Garlic has some blood thinning properties. So you do have to be careful with garlic with blood thinning if you have any bleeding. So if you have weeping of the tumor or bleeding of the tumor and you increase a dose of garlic, it's going to cause more blood thinning, and that could be a danger. So I would be cautious of that. If you're on any blood thinning medication, you need to talk to your prescribing doctor of that medication before going on garlic, because of all the supplements known to man, garlic has the strongest blood thinning component to it. And you should not also be taking garlic prior to a surgery. So you should probably go off garlic a week before any type of surgery, because it will decrease clotting factors. We didn't have a lot of questions come in. Let's see if anything else came in while we were talking. Nope. So that was the only questions that we had for today. What is the date today? So we have two more, actually one more Monday. Next Monday will be the last Monday. Let's see, maybe I will do it the day after Christmas. I don't know. We should be closed the day after Christmas. So next Monday may be the last Monday we do Zoom calls. We don't have that many people on Monday Zoom call. Usually at least you guys that are on here are on Wednesdays too. So any other questions before we bid adieu for the day? All right, hopefully you guys are all prepped for Christmas. You're planning some fun times with your families. It's always a busy time of the year, and you can't negate the fact that you have an increased stress just because of that fact. So make sure you're guarding yourself and you're protecting yourself and you're getting your rest and you're taking naps when you need to take naps, and you're really listening to your body, because you can be misled. You don't really understand the inner stress that's going on inside of you. You got cancer, you have lots of stuff going on, and now you got holidays and Christmas and expectations and family get-togethers and all this good stress maybe, but it still is stress to your body. So don't ignore that. All right, Love you guys all. I will see you in a couple days. Bye-bye.